This video is the skill for administering medications by mouth orally. I will be choosing to use the by mouth route for this skill. So first I would go to my med cart, make sure I have all my necessary equipment, make sure everything's stocked. I would get a report from the previous nurse. We would count our medications, etc. before I start my shift, check on my patients. So when I begin to choose a patient to give their medication at the correct time, I will check the MAR, choose the patient, check for the dosage, check for the right time, right patient, identify them, etc. In the MAR for that specific oral medication, there will be instructions whether it needs to be crushed, given whole, split with a on a scored tablet, or whatever the case may be, whether it needs to be put in pudding after crushed, or any specific instructions. So I would check the MAR, I would prepare the medication, I would go to my patient's room and I would knock on the door. I would be washing my hands before this, and I would explain to them that I'm bringing their medication, what it is, what it's for, make sure that they are comfortable taking that medication. If they refuse, then I would document a refusal. But if they choose to take the medication, then I will be taking it over to the bedside with a cup of water. I would make sure that I physically watch them take their medication before identifying them, or after I identify them, and I would make sure that they took it, and I would return to my medication cart and document that they had taken the medication, and that I used all the instructions beforehand. If a resident refuses, or a patient refuses to take a medication, I could document a refusal, or I would lock the meds away, get a supervisor, and ask for assistance. Maybe another person could deliver the message in a different way, and possibly they could get them to take their medication. But yep, that's about it.